Hey folks, I'm Dr. Gabe Rodriguez and I practice concierge medicine in Helotes, Texas. This month's Medical Minute will be on major depression. I found it important to cover major depression this month because of the many stressors that affect our lives on a daily basis and the effects that they may have on our mental health. Our mental health is just as important as our physical health. I will start with the basics, move on to the causes, talk about risk factors, and then end off with the treatments. All of this in about 4 minutes. The basics. Major depression is defined as a loss of interest or pleasure lasting more than 2 weeks with associated signs and symptoms such as changes in appetite, changes in sleep, loss of energy, diminished concentration, feeling of worthlessness, recurrent thoughts of death, or social isolation. 5 or more of these symptoms must be present for greater than 2 weeks. I think a key feature here is greater than 2 weeks. We all get depressed when we get that tax bill, or our favorite ice cream is out of stock, or we miss out on our favorite concert because it's sold out. Greater than 2 weeks is an important thing to take into consideration. Major depression is associated with significant morbidity and mortality, including an increased risk of suicide. It often coexists with other chronic medical conditions, such as renal failure, heart failure, thyroid disorders, etc. Major depression has a higher prevalence in women. The cause of major depression. The biological or chemical cause of major depression is an imbalance in neurotransmitters in the neurosystem, such as serotonin, norepinephrine, and dopamine. These neurotransmitters affect our behavior and mood constantly throughout the day. Risk factors. Risk factors for major depression are multifactorial. A positive family history of depression can lead to a high genetic predisposition. In addition, medical illnesses such as renal failure on dialysis, congestive heart failure, or chronic illnesses such as diabetes or MS can lead to changes in lifestyle and decreased independence that may lead to depression. Furthermore, some medications may have depressive side effects also. Finally, psychosocial stressors may lead to depressive symptoms such as an adverse life event, death in the family, loss of employment, or loss of an important relationship. Treatments. Treatments can be divided into 3 categories: medications, individual counseling and therapy, and finally, electroconvulsive therapy. First-line medications include SSRIs, SNRIs, dopamine norepinephrine reuptake inhibitors, and norepinephrine serotonin modulators. The best tolerated of these are the SSRIs and the SNRIs, which are usually a good place to start for most patients. Second-line medications move on to the TCAs and the MAOIs, which tend to have more side effects and more complications. Alongside medications is the need for individual counseling and therapy. Continued research shows that medications, along with weekly psychiatric therapy or counseling, exhibit the best results. Finally, electroconvulsive therapy is considered for severe or treatment-resistant depression. This is normally only instituted by trained psychiatrists in a controlled hospital environment. Well, folks, that's all I have for today on this month's Medical Minute topic of major depression. Thanks for listening. Take care and be well. Remember, your health is your greatest wealth. So long.